Today is June 4th, 2015. I am in Lilburn with Miss Bernice Dixon. We are finishing up her interview today. This is Tracy Drummond. I am the archivist for the Southern Labor Archives at Georgia State University Library. Welcome back to the last part of your interview.
Thank you.
So the thing I wanted to cover today is just to sort of follow your career path a little more and have you talk about each of the jobs a little bit and just sort of get that. And then we'll finish up with maybe anything you want to talk about that I haven't asked you, although the way you're looking at me is you saying you feel like you've already talked enough. So, which is absolutely not true. So, I remember that we covered from 45 to 48 at Grady. You were head nurse in charge of the surgical unit. But we didn't really talk too much about 48 to 49 when you went up to Marietta for just a short time to work in the operating room. So was that a big difference from Grady when you got up to Marietta?
Yes, it was, but let's go back just a little bit.
Sure.
I graduated in 1945, and I became the head nurse of Ward C, the medical surgical unit. And I was there during the Wine-Cough fire and all of that. And then in 1948, I went to Marietta, and I worked in the hospital there in the operating room. And I spent 2 years there. And that's the one time that I really had the only real automobile accident. I had bought me a new 1948 Hudson, and I was on my way to Augusta for a weekend. And on the way, there was no interstate at that time, and just before I got to Greensboro, there were two trucks. It was misting rain, and there were two trucks going down the road, and they're throwing mud up on my windshield. Mm-hmm. So I could see a straight, clear path ahead of me, and I started to pull around them. And when I did, they moved over across the middle line, and I had to get off on my left wheels were off on the shoulder of the road. Mm. And when I got past them and tried to cut back, I skidded across the road. My car stood up on its nose and flipped over twice out in the fresh plowed field. I had a laceration on my head, and I had a fracture of my clavicle and a couple of ribs. And the doctor in Marietta sent his driver and his car down to get me, to bring me back there. And of course I was treated in Greensboro mm-hmm. for the fracture and everything. And so it took me a while to recover, but I kept right on working. Mm-hmm. And then I decided, well, Grady wanted me to come back to work for them. Mm-hmm. And I did. I went back to work because I really wanted to go back to school.
Okay. But before we get to there, what did you do in Marietta? Because you just talked about your wreck, but you didn't talk about what your day-to-day duties were.
I worked in the operating room. Mm-hmm. My friend and I, who was a Grady graduate, were the only two nurses in the operating room. And the hospital was owned by two surgeons. And there was another pediatrician that was in with the ownership too. Mm-hmm. And Dr. Merle Haygood was an excellent surgeon. And I learned a lot. We took care of a lot of different patients. And it was while I was there that I saw my first embalming.
Really?
We had a patient had acute appendix, and she was tremendously overweight. As a matter of fact, we didn't have any retractors that could retract her body, so my friend and I retracted while the doctor did the surgery. Later on, she died, and we were able to go down to the funeral home, and they allowed us to see her embalmed. It was no fun. I never wanted to see another one, but it was an experience, and I learned a lot there. I always liked the operating room. I worked in the my time at Grady. I worked both in the white operating room and the colored operating room, and whether or not you really learn a lot or feel like you've done a good job depends a lot on your surgeon, because we had one surgeon that was, well, he was very impatient, and one day I stayed up practically all night trying to memorize the instruments he liked to use and which one was what and this sort of thing. And so during the surgery he asked for a vein retractor, and I handed him a vein retractor. "This is not a vein retractor," he said, and he threw it across the room. So I handed him another, which was a nerve retractor. And he said, "This is not a vein retractor," and he stuck it in the surgeon's pocket over here. So I just stepped back and I said, "Then select whatever you want to use." And but all the difference in the world, because most of the surgeons were excellent. This man was an excellent surgeon, but he was very impatient, and he was patient-oriented, but he was very impatient with the people working with him, and I must have really irritated him. But he was an excellent, he really was a good surgeon. But that happened at Grady. Now, Dr. Haygood and every surgeon out at Marietta that I worked with, they were excellent. And this hospital closed when Kennystone Hospital opened. So that's when I was out there. And I went back to Grady and started school at night. And I worked, 8 to 10 hours a day, and then went to school at night. And actually, I was working in Central Supply at that time. And the School of Nursing needed a teacher in pharmacology. And they learned that I had I think I made an A at Georgia State. And so they asked me if I would teach. Well, I got help from my teacher up there. And so I started teaching. And I was teaching, and I was working my full 8 hours in Central Supply and going to school at night. And after about a year of this, I said, I've got to do one or the other. And so they transferred me to the School of Nursing. And I was there, and I taught medical surgical nursing, and later on I taught communicable diseases. I taught just about everything except pediatrics and obstetrics. And then a situation arose, and I when I started at Georgia State, the practice teaching, we had to have a quarter of practice teaching, and it was supposed to be at Georgia Baptist, Miss Emmeline McKee was the teacher. And but when I got into the program and had finished everything except a quarter of practice teaching, and I've been teaching for about 5 years, they no longer had it here. You had to go to Augusta. Well, by that time, I was married and I had 2 little ones. And I went down to the University of Georgia to talk to the president about it, but I never got to see him. And I had no alternative if I wanted to get a degree. So I was at Grady, and I was working, and I was doing all of that, and I had finished my BSNE except for that quarter of practice teaching. And I had some difficulties, and I had an opportunity to go over to Georgia Baptist and teach in their school of nursing. So I taught over there for 2 years.
Mm-hmm.
And while I was there, I took a quarter's leave of absence and went to Augusta. And I'd leave every Monday morning very early and drive to Augusta, and I'd come back either Friday night or Saturday. I never did any practice teaching while I was there. One time, I'll take that back, and it was a program for all the schools in the Atlanta area, and I was a grade in when I taught it. But anyhow, I learned a lot, though. I had Mrs. Lee Alt, who was the person who was in charge of me. She was my mentor. And I think I've said this before, but she made me defend everything that I knew.
Mm-hmm.
Any decision I made or anything I said, she made me defend it. And that helped me because I knew a lot of answers, but I was not very forthcoming with my response. I'd try to hide behind somebody in the classroom so the teacher wouldn't call on me. But she made me defend everything, and that helped me a lot. And I went back to Georgia Baptist, and then Grady asked me to come back to Grady.
Okay, because you got your degree, your BS in nursing in 56.
Mm-hmm.
And then
in 1956, I was at Georgia Baptist for 2 years.
Mm-hmm.
In 1956, I came back to Grady as chairman of medical surgical nursing.
Okay.
And
so, what did that job entail? That's a really big title. What did that entail?
What, chairman of medical
mm-hmm.
surgical nursing?
Mm-hmm.
We had medical surgical nursing 1, 2, and 3. And the chairperson was in sort of the head of the group.
Mm-hmm.
And I taught, but I worked with all the teachers, and we had some wonderful, wonderful teachers. As a matter of fact, the instructors and the students made school of nursing. And I was there until 1962. And I decided I needed to do something. I needed to and I decided to go back to school.
Mm-hmm.
And I made application to Emory.
Why did you decide to go back to school?
Well, the director of nursing education, she and I had some disagreements about what and how medical surgical nursing should be taught. And she told me one day that, and I think I've said this before, that she got everything she could out of anybody and then kicked them in the seat. And that's exactly what she was, I think, trying to do to me.
Mm-hmm.
And it was sort of dividing the faculty up, because a lot of the faculty really, most of them, as a matter of fact, supported me. And I didn't want that to happen. So I said I either have to resign or go back to school. I decided to go back to school.
Mm-hmm.
And I made application thinking I'd get in the next January. I think I sent in my application about June. And they sent me back a telegram and said, come in and take my pre-examination, and I could come in September. Well, that's what I did. I don't know what I made on the pre-exam because I never wanted to see what it was, but I got into the program. And I was there for a year. You might want to turn that off till she gets through.
I know. She'll be done in a second.
That's her. She's decided to eat. But that was quite an experience.
And where did you get your master's degree?
I got my master's degree in 1963.
But where?
Oh, at Emory.
Emory, okay.
Yeah. Master's in nursing. And I had to do a lot of clinical practice. I had to take care of a lady who had a hip replacement and got an infection. They had to go back in, and she was in isolation. And I'd get there early in the morning and try to get her all situated. And by the time I did, it was 9:30, and my class started at 9 o'clock. So I'd have to run across campus and come in 10 or 15 or 20 minutes late, and only one seat in the middle of the room. And then the professor stopped at 10 minutes of the hour. So I felt like I was not, so what, I'd stay late in the afternoon to be tutored. We had older students or other faculty members that would tutor us on certain things. And one situation happened in that particular class that the professor said that somebody had cheated. And they really had. I didn't know anything about it. I was so concerned about myself because I didn't think I was going to pass the course. And so he said that what the final exam, we'd be seated in the armory. Every other row, 2 or 3 seats in between. And that was the only exam that would count. Whatever we made on that exam would be our grade for the course. And somebody walking up and down the aisle, and then if you had to go to the bathroom, somebody had to go with you. And there were 10 questions, and if you missed one, you literally missed them all, which is very poor test construction.
Yeah.
I knew better than that. But that's the way it was. And I wouldn't go to find out what I made. I just knew I had failed it. And Dr. Mary Margaret Williams, who was the nurse in charge of the program, she was wonderful. She said, Miss Dixon, stop worrying. She says, just stop worrying now. And I went to her, and she said she was so concerned about me because I just knew I had failed. And somebody went down there and he posted the grades. And I want you to know I had passed it.
Well, of course you did.
And I nearly fainted when I found out.
So you were able to work at Emory Hospital and go to the nurses program at the same time,
For the master's
degree.
program, I took a year's leave of absence.
Okay, you did. Okay, okay.
I had to because it
was too much.
I was in class all day and then had to drive home at night
but were you married with kids at this point?
I did.
And
my poor husband, all night he did my typing for me because he couldn't afford for somebody to type my papers and everything. I've still got the typewriter downstairs. Wow. And he would sit there and type. I'd write because I had all these reports I had to bring in. and all the research that we had to do and all of that. And he'd type. He was a pretty good typist. He made a lot of mistakes. And get the children to bed.
Mm-hmm.
And then I'd get up early in the morning and take them across town to my mother's. We lived in southwest Atlanta and she lived in northeast Atlanta. And then I would go on to school. And then I'd come back by sometime and pick them. Sometimes I just let them spend the night.
Mm-hmm. Mm-hmm.
But yeah, it was a rough year.
Well, and how many other women in the program had that same situation where they were married with children, or were most of the women in this program single?
Many of them were single. Most of them really were,
Mm-hmm.
or they didn't have children.
Okay.
There was one man and woman, husband and wife, who were in the program.
Okay.
And
And so was this time about the time that you started seeing more men in nursing programs?
didn't see a lot of them
Mm-hmm.
then.
Mm-hmm.
No. It was later on. Well, I'll take that back. It was in the 60s, but yes, it was in the 60s. It just began seeing more men. As a matter of fact, Grady admitted there first in 65.
Okay.
But when I was near graduation, Grady Hospital called me and asked me if I would come back as director of the school. And I still don't know what happened to the person who was there, because she and I became very good friends later on.
Really?
Excellent friends. Oh,
The
yes.
woman who had sort of been bothering you before ended up being a good coworker.
But anyway, they asked me to come back as director of the school, and I made $500 a month. But I did it.
That was your starting salary?
That was what I made.
Okay.
As a matter of fact, I probably made that for 2 or 3 years without a raise, because they didn't have a lot of money.
Mm-hmm.
Well, I don't guess well, maybe they've got a lot now. They can pay their CEOs a lot of money now. The nurses too are making more. But anyway, and that's when I became director of the School of Nursing, 1963, September. Miss Hammett was the director of nursing, and the School of Nursing was under the director of the nursing, and so was the director of nursing education. As a matter of fact, I was sort of director of nursing education in name only for a few years.
Mm-hmm.
And it was in 1965 that we had an accreditation visit, and we did not get reaccredited. We lost our accreditation. As a matter of fact, I don't guess I really realized what was going on, because Miss Hammett was in charge of everything. We had some students going on affiliation, and the hospital administrator called me, and they didn't go at the regular time, and they needed their tickets. And he asked me where they were. Called me on Saturday. I told him I didn't know. He said, "Why don't you know?" I said, "I don't have that responsibility. Here I am now, in charge of the School of Nursing." And he says, "Well, why don't you have?" I said, "Well, Miss Hammett has that responsibility." I said, "I don't even have the records in my office." So the next Monday morning, Miss Hammett came bringing, all the records were brought around to my office, and things became a little different for me, because I don't think the hospital administrator really realized that I was just there helping out, sort of doing what I was told to do and that sort of thing. But it changed. And when it changed, we when it changed, and I had a consultant come to the school in 1967, and she said, looking back at the recommendations the league had made, that the primary responsibility, or the primary reason we had lost our accreditation was because the faculty members were really not in charge of assigning the clinical practice. Nursing service people were taking care of that and supervising the students. And she felt that was the reason we had lost our accreditation.
Mm-hmm.
So she gave us an excellent...
Talking about the reason you didn't get accreditation.
Yeah.
That
Okay. Is it on now?
it is.
Okay. I also learned that the National League for Nursing's procedure for accreditation had changed. Prior to this time, they sent visitors, and they stayed at the school for like a week, and then the visitors wrote up their impression of the school, and then the Board of Review used whatever they wrote. But they had changed it, and they had changed it to the fact that the school did an intensive self-evaluation and wrote it up. They had the guidelines for the evaluation and wrote it up, and they sent copies to every board member, 10 copies to the National League for Nursing. And the visitors, 2 visitors, also had a copy.
Since they're cutting grass outside, can you speak up just a little to make sure?
Who, me?
Yeah.
My voice is not too good.
Okay.
But they had changed it to sending, the school did an intensive self-evaluation and sent a copy of that evaluation to each member of the Board of Review. And then the 2 visitors came. They had copies too. And the 2 visitors came, and they were there for like 2 days. And they had certain areas they looked at to see if you were really doing what you said you were doing. And after they wrote their impression, they came back and met with the hospital administrator and everybody. Well, they met with everybody to begin with, but they came back with their report. And then their report, the Board of Review of the National League for Nursing actually evaluated the school on their self-evaluation. And then the Board of Review's comments just simply verified all of this, which made a whole lot of difference in how a school was evaluated and whether or not they got accreditation. But, later on I became a member. We got accreditation back in 1958. We had our visit. I became a member of the National League for Nursing Board of Review.
Okay.
And served as a visitor and as a leader for, I think it was 4 or 5 years.
And so you got to review other schools?
Oh, yes.
Okay.
I visited many schools. We couldn't visit more than 2 a year.
Okay.
We'd go on one trip and be gone for 2 weeks.
Okay.
And it was quite an experience. I mean, you learned a lot, and when we had a consultant come, what she said was, identify your strengths and your weaknesses, major on your strengths, but point out what you're trying to do to correct your weaknesses. And the best advice, the person could give. And she used examples, you know, to do that. So I thoroughly enjoyed my time on the board as a member of the board of review.
How long did you serve?
It was about 4 or 5 years.
Okay.
You know,
Okay.
and what we had to do as members of the board of review, every program that came before the board that year, we had to go over their records. But the 2 visitors were the key ones that presented. But each one of the board of review members had to go through the self-evaluation and make their comments. And then we got together and we talked about what our impression was of the school, and the visitors what their impression was. And then a decision was made. So it was exciting, and it was quite an experience to go to New York City for twice a year and spend a week up there, you know. And with all those important people that I got to meet, it was just wonderful. This old country girl. I got to meet some of the leaders, work with them. It was quite an experience. It really was. But and then I stayed on at Grady. Actually, we had 600 students. And then that was in the 1965 or 66. And then the enrollment started to decrease and the attrition rate increased. We did just about everything you could think of.
So let me clarify. Fewer students, but a better graduation rate. Attrition. So more people, fewer students, but more of them graduating. Okay.
More of them did not graduate.
Did not graduate. Okay. Okay.
Yeah. And
what do you think caused that?
the advent of the associate degree program.
Okay.
And also the National League for Nursing really was emphasizing more than just clinical practice. It was the diploma graduate that had the clinical practice. As a matter of fact, I worked on Governor Jimmy Carter appointed a master planning committee here in Georgia. And I was a member, and Catherine Pope, another great graduate, was a member, and Miss Mary Woody, our director of nursing, was chairperson of the group. And we studied nursing in Georgia, and we gave transfer credit to students if they'd been in another school of nursing, if they could pass our basic nursing. We did a program like that. We did a program to admit licensed practical nurses. We would let them come for an intensive course in basic nursing and pass, or if they could pass the test, our basic nursing test, then we gave them credit for that and they could start at the second level. We established a program for admitting medical corpsmen. We did all kinds of things to try to get more students into the School of Nursing. But enrollment dropped. And with the baccalaureate, the associate degree program, the study that we did, the master planning committee, it's amazing. It pointed out how when the associate degree came into being, the enrollment went up like this and the diploma went down. Well, it makes sense. You know, it's not the way I worked in trying to what the purpose for the associate degree program to begin with was so that the licensed practical nursing could move up, and the diploma program would move into the baccalaureate program. Well, it didn't work that way. What they did, they established an associate degree program for 2 academic years. We had the diploma program for 3 calendar years, and then we had the baccalaureate program for 4 academic years, and all of them riding the same state board. Well, it's impossible, and so you could see why a young person would spend 2 academic years and become RNs rather than spending the 3 calendar years, you know.
So they were getting an equivalent degree with like less formal training.
Getting the registered nurse, RN. But then they would, and this is what some of the directors of nursing said, they had to work for about a year before they could really do the clinical, because it was the clinical practice that they were so limited in, and that's still true. It's still true, but and also then as the associate degree they would have had 2 years, and they got credit for that, going on and getting their bachelor's degree, where the diploma graduate did not. The maximum, I guess, that we ever got was maybe 45 hours credit. When our students got 35 hours at Georgia State, because starting back in the 50s, we started sending our students to Georgia State for their basic sciences. So that's why, that is one of the major reasons why the diploma school closed. They began closing all over the country. But the associate degree has limited clinical practice. Well, the baccalaureate degree does have too. But we focused on caring for the patient. We did everything. We didn't have all the different health personnel to come in. When we had patients that needed to be rebreathed, you know, we didn't have the respirator. We gave them a brown paper bag, and they breathed in it and out, in and out, in and out. And it worked. And we did all kinds of things because we did not have all of the electronics they have today. And that's another thing that has changed in that you have so many different groups of people, or so many different professional personnel that come in to take care of patients. We took care of the patient. We did everything for them. And we didn't even have intensive care units back then. They were all on the general floor. We took care of them. And so nursing has changed. As a matter of fact, I'd have to go back to school if I went back into nursing. And I got an offer the other day. This lady called and offered me a job. And I said, honey, she sounded like a young person. I said, honey, I'm 93 years old. She said, you are?
So your name must have been on a list somewhere.
Well, I'm still, my RN is still active.
Okay, I see.
I said I worked too hard to get it, to give it up.
So at what point did you sort of realize that the School of Nursing was going to have to close?
I knew it long before it closed. And
it was just inevitable.
Right. We had an administrator, though, Mr. J.W. Pinkston. He really loved that school, and he did everything he could. But financially, you could not maintain the staff of faculty that you needed to take care and to teach the students. So it was just inevitable, you know. It really was. And we tried to do everything we could. And, but like if we admitted, um, I did a study on the admissions and the number that graduated 3 years later in our program. As a matter of fact, we shortened our program by a quarter.
Really?
We did, from 12 quarters to 11. And that didn't really help. So we permitted, early on, marriage students could not come into the program. We permitted students to marry, and they had to live on campus early on. But we permitted them to live off campus anywhere their parents gave them permission to live. If they were married, of course, they didn't need parents' permission. We admitted male students. We had all those programs to give credit if people had really had any experience in a nursing, whether it's practical nursing, medical corpsman, or whatever. We actually we did everything we could.
Mm-hmm.
And some of our students would come into our program for basic nursing, get credit for it in the associate degree, and go back to to an associate degree program.
Mm-hmm.
But interestingly enough, and I think it's just wonderful, in a newspaper article, when the school was closing, the last class, one of the students said she was in a baccalaureate program. She said, but they didn't have any clinical practice. So I came here because I wanted to have some clinical practice, because our focus was on the patient and the patient's family.
Mm-hmm.
And it was just inevitable. I felt it coming, and financially, the hospital could not continue to afford it either. So we had to close.
And the last class started in 82?
Last class started in 79.
And graduated in 82. Okay.
The announcement was made in January of 80.
Mm-hmm.
And what we thought we were doing was merging with Georgia State, but it didn't work that way.
Right. We talked about that a little bit last time. And that must have been a big disappointment.
Well, Georgia State continued and increased the number of affiliations with Grady Hospital. This is where they got whatever clinical practice they got.
Mm-hmm.
And but the diploma graduate still got such little credit if they decided to go into a baccalaureate program. But you know, I wanted an education. As a matter of fact, I started a doctoral program, PhD program. And then I decided, am I going to put my family through this too? No, I'm not. And
Where did you start that program? The PhD?
The University of Georgia had it in Atlanta.
Oh, okay.
They started a program here in Atlanta.
So let's pick back up with, you had mentioned J.W. Pinkston had been trying to keep the school open.
Mr. Pinkston truly, truly loved the school. And he wanted to keep it open. And he did everything he possibly could. But with all the few students we had, and excuse me, I'm going to put her outside.
Okay.
You're going outside. He did everything he could, and he worked with me on anything that I suggested that might be a way to get more students. He worked with me on that. I explained to him about working on the committee with the Georgia Nurses Association in planning and with the National League for Nursing in planning the for the associate degree, and as our plans were, he said he wanted me to work on that, and we were very active in the national diploma program, and he was just all for the School of Nursing.
During this time, were y'all feeling pressure from Grady to, I mean, were they supportive of your efforts, or, okay, so they were. It's not like you felt like they were really trying to come in.
They were supportive all the way. They had a cost study analysis several years before then, and they recommended that they might consider getting out of the education business.
Mm.
And so it was several years later, though, before actually a decision was made.
Mm-hmm.
But I talked with the students, I talked with the Alumnus Association about it before we closed, and the students understood. And I cannot give enough credit to the students and to the faculty that stayed with me until the school actually closed its doors after the graduation of the last class. They graduated in June of 1982, and on July the 2nd, I had everything that was out, and I had to find me another job or whatever. And I transferred over to nursing service.
Okay, and what is nursing services?
Well, I was patient service coordinator. At that time, all the patient, they had a person on each area in the nursing areas that were responsible for working with the people in the area and budget and getting whatever they needed and this sort of thing. And I was over that entire group. I worked over there. Well, that was disbanded after a while, and I went as an assistant director of nursing service. I was still in all those years, the 10 years I continued to work. I was in charge of the nursing budget, and for any new piece of equipment that came into the hospital, mm-hmm. it had to come through my committee. Okay.
Was that a satisfactory way to end your career, given all the hands-on work you had prior to that with patients?
Well, I would have preferred to stay in nursing education, mm-hmm. but I was so near retirement, I did not feel it would be wise to try to resign and go into nursing education somewhere else. Because, and I worked very hard. I made the director of nursing look good because we stayed on budget. Mm-hmm. And but I had some wonderful people to work with. And
well, do you want to talk about any of those people? Is there anybody that maybe we haven't covered that you could
well,
that you want to mention?
You see, while I was working in that position, I worked with every department in the hospital. Mm-hmm. And I became acquainted. I had seen these people, but I really worked with them. We had the most wonderful people working there. They really, it was like a big family, and everybody was interested in seeing that Grady was the best. And the patient was the focus of everything we did. Now, as I told you before, we integrated with no problem. Mm-hmm. But there were people that felt we weren't doing what we ought to be doing.
Meaning?
I'm not sure that I ever, that I told you about this, but I was called one day. Now this was, mind you, we integrated in 1965. And this was in, after the school closed, it was in the 80s. And somebody called Mr. Pinkston and was questioning the assignment of patients in rooms throughout the hospital. And he called me one morning and said, I need you to check every patient room in the hospital, starting 13th floor down to the 3rd floor, and tell me the patients assigned to the rooms, whether they're white and colored, or colored and colored.
Mm-hmm.
What we were doing, we were assigning them according to what was wrong with them, wherever we had a room. So I started.
Is that how it usually works in a hospital, that that patients are assigned to an area based on what they're there for?
Yeah.
Okay.
Like surgery.
Mm-hmm.
The surgical patients were assigned to the surgical floors.
Okay.
And prior to our integration, the C and D areas were for the colored patients, and the A and B areas were for the white patients.
Mm-hmm.
But when we integrated, we just integrated the patients according to their diagnosis. And so I checked every patient room from the 13th floor to the 3rd floor and gave him a report. That day, I did all that in one day. And I was tired when the day was over, but I did it. And there was no problem because we truly did that. And
had somebody made it sound like patients were being assigned unfairly?
Somebody had questioned whether or not we were doing it. So, and I had, actually, they did that in the School of Nursing. What I did, I admitted them alphabetically. So I didn't know whether the A's were all whites or all blacks or mixed or whatever, but they were assigned alphabetically when they came into the school. And then, because they had...
You mean the students?
Students. We had to have 2 to the room.
Right.
And so after 6 months, they could choose their roommate. I gave them an opportunity to choose their roommate. And I was on vacation up in the Tennessee mountains with my husband and a group of young people from his church. And Dr. Martin Luther King Sr. was questioning whether or not we were doing that. So I had to come back. And we went through all the nurses' residences. He wanted to be sure to check in Hirsch Hall. They had a community bath, whereas all the students, like living on the floor, used the same bathroom. If they were assigned to the individual rooms, well, actually, the head nurses were assigned to rooms. And so he had to check that. We had, I think it was 3 tubs and 3 or 4 showers in the bathroom, and all the commodes we needed. So we walked through every nurse's residence and checked everything there, no problems. But they would have questions and they wanted to be sure. I guess they didn't trust. They didn't trust us to do it. But actually, Grady Hospital, I worked over in the colored operating room. And when we had that Fats Hardy incident where all those people suffering and dying from drinking wood alcohol, all of us, white, black, and everybody else. We had a few white patients, but very few. And we had so many colored patients, we had them in their cars out in the street treating them because the emergency room was full and everything. And
Because of wood alcohol poisoning?
Mm-hmm.
What's wood alcohol?
Well, ethyl alcohol is what you can drink.
Mm-hmm.
Wood alcohol is poison.
Okay.
And Fats
So
Hardy was the man's name. There were some other people involved too, but he's the one that was prosecuted. He was set. They had increased the tax on whiskey,
mm-hmm.
and so people were getting whatever they could get to drink. And what he was doing, he had kind of dirty water and some peach flavoring and wood alcohol. And I had one patient, I'll never forget him. He came in and we treated him, and he was all right. We let him go home. And I guess it was the next day, got him back in the hospital. And he said, I had some left over and I just couldn't throw it away, so I drank it. And he died.
So what was it doing to people? What's the effect? I know, but like, what was it shutting down part of their vital organs, or was it? I mean, what was the damage that wood alcohol could do?
It was a poison.
Okay.
It was a poison.
Okay.
And as I recall, what we did a lot in treating them, we gave them IV normal saline and some other things, but it was really something. I think it was about 137 people that died.
Oh my gosh.
Mm-hmm.
Oh my gosh.
Yeah.
That's so many. Many.
Well, it was terrible. It was a terrible time.
Mm-hmm. Mm-hmm.
It was a terrible time. Now, there might not have been that many that died. I don't want to confuse that with the Wyandotte fire.
Mm-hmm. Still, though, to have a lot of people show up on the same day with alcohol poisoning.
It was all within a few days there that all this happened. Like I say, within a week.
Mm.
Yeah. It was terrible.
Mm-hmm.
It was terrible.
Mm-hmm.
And there were several people involved, but Fats Hardy, that was they called him, he was overweight, and his last name was Hardy, but they called him Fats Hardy. And he's the only one that was really prosecuted because he was the one that was in charge and owned everything.
Yeah. Ooh.
We had lots of, see, Grady Hospital is home for so many people, and it has been there.
Mm-hmm.
And there's a sign on television today is Atlanta can't live without Grady or something like that.
Mm-hmm.
And that's true.
Mm-hmm.
That's true. And when we opened our burn unit, it was just really, really, there's just no way to describe the feeling we had back then, because everyone, the hospital administrator knew everybody. We were all a part, just like a big family. Anything happened in my department, oh my, there was these people coming in to help. And it was not all the animosity that you feel in a lot of places. It was like you were a member of the family.
Mm-hmm.
And, well, I worked hard, but I enjoyed it because nursing was my life.
Mm-hmm.
And I felt like what I was doing after I transferred over to the nursing service department after school closed, what I was doing had to do with patient care. And I have to give credit to so many wonderful faculty members in the School of Nursing. I particularly Ruth Reed and Imogene Davis. Ruth Reed stayed with me to the very end. She and I went through every record at Grady Hospital dating back to 1898. And she is the one that helped me in making out the list of those who entered and did not complete, and the dates they entered and the date they left, and also those who entered and who did complete the program. She's the one that helped me do all that. She was the most wonderful, kind, gentle, firm person you ever hoped to meet. And she was older when she came into the school because her mother had died and she helped to raise her family. And she was dearly loved by the students. She was dearly loved by the students. But she was the greatest help. Imogene Davis she retired as a lieutenant colonel in the Air Force. And she died last October. Ruth died years before. Ruth had a heart problem when she came into the school. And but she was wonderful. But then I had a lot of others too. Some of them are still living. And Juanita Kimbrough now, she was Juanita Fuller. She was great. She was there until the last person graduated. Just so many people and so many good, excellent. Betty Blake was one of the best faculty members I think I ever had. She truly was. She was so dependable. She was so strict, and yet she was so caring. And she always looked perfect.
Really?
She was the neatest person you ever saw. She still is.
Why has it been so important to you to hold on to this Grady School of Nursing history and to preserve it and to try to share it with people?
Because I felt like the story ought to be told. But actually now what happened is, and I have the papers from Mr. Pinkston on this, what he did, he assigned a doctor to write the history of Grady, and I was to write the part on the School of Nursing to go in that book. Well, this doctor and other doctors wrote the history of Grady Hospital. I tried to get in contact with him, but I never could. So the School of Nursing, except he made some comments on it, and they're not correct. Because in his book, he stated that the School of Nursing was a 2-year program. It was not. They had a 2-year program. And when the Grady Hospital Training School was chartered in 1898, then it converted to a 3-year program. They discontinued the 2-year program. And so the reason he would say that, I'm sure, is because it doesn't seem reasonable that somebody could enter in 1898 and graduate in 1900. They didn't. If they entered in 1898, they graduated in 1901. So there was a group of, in the Director of Nurses annual report, in the annual hospital annual report, she had about 16, I think it was 16 students in the 2-year program, and 6 or 7 of those graduated in 1899, which tells me that the rest of that group graduated in 1900. in the 3-year program. They decided to continue for another year and become an RN. So, but actually, the purpose of the School of Nursing to begin with is to staff the hospital. They said it. It's written out. And we staffed the hospital. And even after we were accredited in 1959 by the National League for Nursing, in 1961, Miss Hammett sent out a memo stating the duties of the student nurse, 7 to 3:30, 3:30 to 11, 11 to 7, and all that. And student nurses were in charge on the 11 to 7 shift most of the time. They had somebody they could call if they got into a bind, a problem. But, and that's the way it was back in the 40s when I was a student.
Mm-hmm.
And that's the way it was continuing, that we did not have faculty to supervise. Now, when I was a probationer, during that period of probation, when we went into the clinical areas, we had our instructor went with us. We had maybe 2 or 3 instructors in the whole school. So it started out, and it was to staff the hospital, and that's what a lot of hospital administrators wanted. But Mr. Pinkston was wonderful. He went along with so many things, and I mean, he was so gracious about it. He, the greatest support I ever had.
And so you've written the history of Grady Nursing?
Beg pardon?
You've written the history of the Grady School of Nursing?
I've tried. So much of it is
a history
from my memory.
Right.
And the others I've gone back. I do have an 1899 hospital annual report.
Mm-hmm.
And 1900, 1, 2, and 6 or something like that. I have the annual reports of almost every year except for a period of time when they didn't have one.
Interesting.
Because the city of Atlanta was in charge of the hospital until 1946. And then the Fulton DeKalb Hospital Authority took over. So there's a period of time there in the early 40s, like maybe from 1939 to on up, that I could not find an annual report. I don't think they wrote one. But the Fulton DeKalb, see, when I graduated from nursing school, my first employment at Grady was through the city of Atlanta. And but when the Fulton DeKalb Hospital Authority came into being in 1946, they took over. Mr. Wilson was the superintendent. Mr. Walker was the assistant. Mr. Pinkston was working there, and then he moved on up as assistant director, and then Mr. Wilson died. They appointed him as director. Very, very intelligent man. He's still living, but he's not well.
Well, I'm sorry, were you going to say something?
Mm-hmm.
Were you going to say something?
Not that, the only thing I want to say is that Grady is a part of me, and I am a part of Grady. Mm-hmm. And I hope that we'll be able to find all of the things that I had saved, and that they can be put into the archives so that they can be available for other people.
Mm-hmm. Me too.
And I'm hoping this history, or this story that I have written, that people will understand what Grady Hospital really is and what it's all about.
Mm-hmm. I think it's such an important piece of Atlanta for so many reasons. Because it's part of the community, it gave young women a way to earn a living. It was one of the best programs in the country. I mean, it really is important, and I feel like, because when we started talking about this project, and and I know that we've got a small Grady collection of the labor archives, I just felt like that was not a substantial amount of documentation on what had happened and on the history. And so I'm glad that we are pursuing all these avenues to really get that history together, and I'll be very interested to read the history you've written.
I would have had it finished had they not moved me and boxed up my material so many different times. Mm-hmm. And also, had I not had so many personal difficulties with the family and illnesses in the family and all of that. And it's been in the back of my head all these years. And it's been, and to handwrite it all, and I had to do that, if you can imagine. And then I'd go back and scratch, and then I'd correct something and go back and add something else. But I have a reference for everything I've written.
Good.
I have not written anything that's not true. Mm-hmm. So it's a story. It is a story of the School of Nursing from my perspective, and I was a part of the School of Nursing for so many years. So,
and you, I think, more than anyone, because you got your degree in the 40s when you were, you've seen Grady's history except for maybe the first 40 years. You've been there to experience Grady's history. That's phenomenal. I don't know how many people can say that. Maybe you were the only person that can really say that.
I don't know. But and two people that stand out so much, not except faculty and all of those. One was an orderly, Squire Benning. Most precious little man. He was a little man, but Squire was there when I needed him. He was so efficient, just so wonderful. The other man is Mr. Dewey. He was on the hospital maintenance department, and he worked nights. And he was the student's friend at night. He'd pop up, have a bar of candy or something, and talk to you. Mm-hmm. He was just wonderful. Of course, they all were.
Right.
But Mr. Dewey was there when I was a student. So was Squire. And he was the greatest help to me. He knew how to take care of patients. And back in the very early days, the orderlies took care of the male patients, their personal care. And Squire was right there. He was just wonderful. Of course, we had others too, but he just stood out. Mm-hmm. So many people, I could... From the day I entered the School of Nursing. But the School of Nursing can give the credit to Miss Annabeth Feebeck for setting the standard. And I really tried to maintain her standard. I could never do it like she did. Never. Because that lady had a vision, mm-hmm. and she worked toward it. She was patient, firm. Sometimes we thought she was mean, but she truly wasn't. She was fair. And it does hurt when people correct you a lot. You think they're mean, but it's for your own good.
Right, right.
So, and I thank you for listening to me and all my ramblings.
It has been a pleasure to interview you.
I guess I could go on talking about Grady forever, though.
Well, we can always have a follow-up interview if you think of anything. I mean, you're shaking your head, but
I could think of a lot of things. It comes to me every day, but there's some things I don't think you want me to record.
Okay. Well, if there is nothing else, is there? Then I will wrap up the third part of our interview for now. Maybe we can add another one at some point in the future if you want to. Thank you so much for sitting for these interviews. They will add a great deal of context, not only of course your life and career, but that of the Grady School of Nursing. So I really appreciate it, and I feel like generations to come will really enjoy listening to the story.
Thank you for your patience and all my ramblings.
You're not rambling at all. You're not rambling at all.